Dr. Mora, Orange County Orthopedic Surgeon. I want to show you a technique that we use when we're going to do knee arthroscopy under local anesthesia. It's not fully local because right now, as we speak, the patient is actually under Propofol sedation. That means he was given an IV sedation to put him to sleep. He's going to be asleep for about 5 minutes while I do this. Okay, so what I'm doing is I'm numbing up my areas that I'm going to be injecting with local. This is a mixture of 1% lidocaine with and 1/4% marcaine. Correct? Yes. Thank you. I'm going to use 30 cc's. The patient's asleep right now. He's just asleep under IV sedation. And what I'm going to do now is put some. Sometimes the patient moves. Can you hold him over here? Please hold his focus. Sometimes there's a reaction. Just push down. Sometimes the patients kick a little bit. They kick sometimes, but not too much because did he get any fentanyl?
A little bit.
Yeah, so see, he also got a little bit of fentanyl, so that kind of keeps him from kicking. Okay, number one. And then what I do is I go like this, and he's already ready to go for these other two injections. These injections are very important. Okay, inferior polar patella. This is where my portal site is going to be. I inject all the different layers. Sometimes it squirts, you got to be careful. Aim at the notch. Boom, right into the notch. And then I go up a little bit to get the fat pad. And then more importantly, medial capsule. Okay, medial capsule like this. Poke, poke, poke. Get this really well because the patient is going to be waking up in a few minutes here. And I'm going to be putting a camera in here. And the patient is going to be wide awake. Now how does that happen? Well, number one is he's numbed up pretty well. See, I can't do this with a patient awake. It would hurt. This is an 18 gauge needle, 60 cc's of local. I'm injecting this in the path of my future scope. My scope is going to go into the patellofemoral joint. It's going to go into the notch, and then, like I said, the capsule. Okay, there's some capsule right there, the meniscus, and get all of it in there. It's all in. Now, part two is this. We have to compress. Okay, so I'm compressing the knee by maximally flexing, extending, cycling it. I do this over and over. And one more very important point: the patient is not prepped and draped. As soon as I'm done here, then I go scrub, and then the crew here, the team here, will then do the usual prep and drape. And by the time the prepping and draping is done, the patient will have come to. He'll be awake, and he'll be following commands. The most important part, or another important point about this, is not to give the patient Versed, because if you give them Versed, they're not going to have any clue where they are, and they're going to fight you at every point during the surgery. So once again, this is how local anesthesia is injected in preparation for knee arthroscopy under local. A little bit of Propofol, a little bit of fentanyl, no Versed, inject intra-articularly 30 cc's, 15 cc's in the direction of your portal. Compress, and I think the money is putting it down, going to scrub, coming back, and that gives it about 10 minutes to set, and you can start arthroscopy wide awake. That's it. Thank you. Mora, again, I forgot to mention one thing about doing arthroscopy under local. You can't use a tourniquet. If you use a tourniquet, the patient will experience thigh pain, and that will become a problem while you're operating because the thigh is not anesthetized. So you can't use tourniquets, so instead you have to use an arthroscopic pump. When you use an arthroscopic pump, the pressure is what keeps the area bloodless. So that's the last point. I forgot to mention it while I was in there. No tourniquet because it'll cause thigh pain. The patient just won't be able to deal with it. And then lastly is patient selection. You do have to select the patient carefully. You can't operate on a very anxious, patient who has, exaggerated pain response. It won't work. You got to choose your patient wisely, make sure they're right, they're good. And then of course you, as a surgeon, you have to be calm and you have to be able to gently move the leg and also coach the patient through, especially in the figure 4 position. You got to be able to have that patience yourself. So those are the important points. Thank you very much. Very good. So we're inside the knee. The patient is prepped, draped. We're inside the knee right now. Sir, are you feeling comfortable?
Am I feeling comfortable?
Yeah.
Yes.
Good. Okay, thank you. I was just doing a little video educational tape. I'm not going to say your name, okay?
Yes.
And I just wanted to let, this is for doctors who don't believe that local anesthesia can be done with knee arthroscopy. So it's not that they don't believe, it's just that it's, you know, people need to learn, right?
Yes.
Even our anesthesia team sometimes has a hard time believing that it can be done, and they want to snow the patient, meaning they want to put you down. But you're pretty wide awake, is that correct?
Yes.
Okay, and you're feeling pretty comfortable right now?
Absolutely.
All right, well, thank you so much. So what I'm gonna show here on the screen, we're in the joint, okay? And as you know, I just videotaped a little earlier. About 15 minutes ago, we did the prepping and draping, and then I washed. They actually draped. Then I came in, and the patient was still a little sleepy when I put the camera inside. But then after about 5 minutes, he woke up. So I'm just in the patellofemoral joint. I'm starting the procedure, and he's wide awake. So I just wanted to show you how it's possible. Okay, so remember, you have to be gentle at this point if you're going to do this. So one more thing I wanted to show you is, you know, if you're gentle and you do things right, you can even get in the back of the knee. Like this is the view of the root right there. You can see an old root repair that I did on him. You can see the sutures right there of the root repair. I'm in the notch right now, and the patient's leg is off the side of the bed. Here is a root repair that I did previously. I'm just probing this.
See that? Yeah.
The meniscus, right? Or I have a little suture there. I'm going to pull on it in a second. But it's more than anything else, I want to show you in the back of the knee right now. Patient's still awake. Are you doing okay, sir?
I'm doing fine.
Okay, thank you so much. Okay, that's all. Thank you. The last thing is, which I didn't mention, I do have a heat device in the knee. You have to be very careful with the heat, because if you use too much heat, then that pain penetrates the capsule, penetrates the layer that you've anesthetized. So you can't use too much heat either. So that's another important point at the end. I know that I mentioned a lot of important points, but that's the last one I have to tell you. Okay? Thank you so much. Over and out. Dr. Mora talking about local anesthesia for knee arthroscopy.